Hi, everybody. Welcome to Take Charge of Your Health. I am Dr. Melissa Balizan, your host, and today I have with me Dr. Brigette Serfaty. She is an executive integrative health coach. Welcome, Brigette.
Thanks, Melissa. It's nice to be here. I appreciate the invite.
Yes, I'm so excited to have you here. So let's talk about that big word, integrative health. What actually does that mean?
Yeah, it is a big word. And so integrative really means integrating the whole person. And so it's not just about what we traditionally think of as health, like your weight and your blood pressure and how much you're moving. It's how you're really living in your life. And so we look at life and work and sleep and food and movement and just all of those pieces that make up a life. And so it's much, much bigger than what we think of as traditionally health. So there's more coaching involved and more understanding of the client's experience. So the client is really driving the bus and the coach is really listening to what they want. So integrating all of you into life.
I love that. And I love that model because I love that this is the way I hope that healthcare is going. More of, the client or the patient actually, driving that bus and really getting involved with what's going on versus just coming in and putting a Band-Aid on whatever is going on that day. So talk to me about maybe some of the common health problems that clients would come to you to be helped with.
Sure. And so sometimes it is really a health issue in that they're looking at managing weight or they want to start an exercise program. But more often it's something related to work. And so there's a stress component that's bringing some concern. They're unhappy with work or relationships. They're not really engaged. They're not as happy as they could be. So it's something else that's really driving the conversation. And then we may get around to health, or we may stay with that other thing. Could be creativity. It could be, I want to change jobs. It's really dependent on what they are dissatisfied with in their life, but it's all ultimately about well-being and what do they really want. So we dig really deeply into what's meaningful to that person. And I love that you said, I hope that's where healthcare is going, because we've really kind of reduced people to a body part, and that's not what any of us want. We really want to live our best lives. So I'm glad to hear a like mind.
Absolutely. And I think that's, it is more than just a little body part. That body part may hurt or something, but it could be something else. It could be that job that's causing that body part to hurt, So let's talk about a body part, a big body part, kind of the brain as far as your mind. So talk to me a little bit about mindfulness and how that works into your practice.
Yeah, and so I start there a lot of times because people are so amped up and there's so much anxiety and stress. And so very often we'll just begin with, let's just sit here and breathe and figure out who you are and what you want. And so we can kind of come down off that anxiety cycle. So that's where the brain comes in. And so people are sometimes interested in a formal mindful practice where they really learn to connect with their breath and their bodies. Other times they're not quite ready for that or quite so open to it, and they really prefer just to figure out how to be more present in a conversation. So we have some tips for that too. We'll work on just how do you pay attention to one thing. So as you know from being in the healthcare field, we're distracted all the time. And so our brains are wandering, we're distracted, we're doing 2 or 3 things at a time. And when we do that, we're really unhappy. We're not fully present. And that's what mindfulness does, is just bring us back to being able to focus on the one thing that's in front of us so that we can be more engaged in that one thing. And so there's all of this training with mindfulness, whether it's an app or a person or a practice, to be able to just pay attention to that one thing. So paying attention to present moment, noticing your experience, in your breath and your body, your thoughts, your emotions, and then giving yourself just a space to be able to respond to it instead of just reacting habitually, usually in a negative way. So that's it in a nutshell. So we're really training our brains.
No, and I love that. And so since this is simple steps that we can do today, Can you give us an example of maybe how we could do a short practice of this mindfulness? Because a lot of times when we hear mindfulness or we hear meditation, our brains go, I can't do
I
that.
can't do that. Yeah.
So
Yes.
walk us through what maybe that would
Yeah.
look like.
So I'm happy to do a short practice, but really it's about just being present, as I mentioned. And so something that would be really simple that you could put in your day is before you walk into a meeting or before you move on to the next task, just standing or sitting where you are, really feeling your feet on the floor or your seat in the chair, and then taking some deliberate breaths. So it can be just that easy. So you can start with a minute, you can start with 30 seconds and just breathe and not do anything else, which is hard for us. Would you like to try practice?
Yeah, let's try practice. Let's
Yeah, let's do it. Yeah, and then I can talk a little bit about how to get started if that's interesting. But so let's just wherever you're sitting, and we'll both play too. So we're just sitting in our desk chairs. Our feet are on the floor and feeling both feet, just sitting in your chair comfortably and allowing your eyes to close if that's comfortable for you. You can also keep your eyes open. So just letting your hands rest in your lap and just taking a deep breath or any breath, not trying to control it, but just feeling yourself breathe. Maybe you can notice some body sensation. Maybe your shoulders are a little tense. Maybe you're feeling like you're tired. Just noticing anything that you can without judging it. Just being curious about what's here. Letting yourself settle. And maybe noticing that in between your inhale and your exhale, there's a little space, just a little pause. So just finding that opportunity to rest. Nothing to do other than just connect to your breath. Knowing that it's okay that you've wandered away in your mind, you just bring yourself back. Maybe noticing that you can settle just a little bit more on an exhale, just letting yourself relax and soften. And now just bringing your attention back more fully to deepening your inhale and lengthening your exhale. And when you're ready, you can just simply allow your eyes to open and bring yourself back into the room. And that could be just a few minutes of practice at your desk or anywhere else that you are.
That's awesome. That was very relaxing. Now I'm like, oh, I can just.
It's kind of like a little vacation, you know, from all of the rushing that we tend to do.
We do a lot of rushing, and it's just, earlier today I told my friend, I said, I have 3 minutes for myself right now, and I just took that 3 minutes just to be with myself, relax, breathe, and she's like, you should take at least 5. I'm like, well, sometimes you don't have 5, but just that simple practice, we know it can be done in just, a minute or two, just taking that extra, that awareness. And I
Yeah.
love
I
it.
love that too. And one of my favorite mindfulness teachers is Shauna Shapiro. Her TED Talk is amazing, but she talks about what you practice grows stronger. And so this idea that we're really practicing busyness, so we're cultivating busyness and overwhelm and stress, and because it's what we do, so just to take that, as you mentioned, that 3 minutes for yourself, we can also practice that. And that's a lot of the work that I know I do with clients, is just to figure out how to put that time into calendars, so you actually do it. I'm going to take this time for myself, and then there's a goal of what I'm going to do. And mindfulness is supportive of that, mostly just so you can notice when you're in that state of fight or flight and anxiousness, so that there's something else, other than that.
Absolutely. And I'm glad that you mentioned that, fight or flight. Our bodies tend to stay in that more so these days now, because we've stressed ourselves to that point where we think a normal day, stress is normal, which there's good stress and there's bad stress.
Sure.
But, our bodies stay in that heightened awareness of that fight or flight. And that's not good for our bodies to stay in that constantly, because all those extra, hormones are being produced, and that's definitely not good. So tell me, how did you actually get started in mindfulness? So, because we're two pharmacists that we varied away from our traditional pharmacy area. So tell us how you actually got into the mindfulness and into the integrative.
Yeah, and so a long time ago, about a million years ago, I was trying to deal with my own work stress, and I won't tell you how long ago, because it was about 30 years ago. And so I really came to mindfulness through yoga. And so I was looking for some way to fit movement into my pharmacy school days, because I was running like a crazy person. So yoga was really my entry. And so throughout my whole pharmacy career and all of my leadership career, I was always the one that was preaching work-life balance to my team. And so I was doing integrative health long before I even knew it was a thing. and mindfulness was part of that. So I taught mindfulness in a corporate setting, and really just decided at a couple of years ago to bring that integrative health piece into my practice. And so I went to the University of Arizona Andrew Weil Center for Integrative Medicine to learn integrative health coaching. And still with that idea of, at the time, bringing it back to my team, because we were in a really fast-paced environment, and I was really trying to practice what I preached and offer that to them. I mean, it was really important for me to, like, you guys got to go home. We can still get this work done and enjoy each other a lot more if we bring these practices, and really do it. So that was the reason that I started, was just for my own personal well-being, and then it's just become part of my practice with clients and with patients and my family and everybody. They
No,
get tired of hearing it.
no, that's wonderful. But that's true. We hear about work-life balance, and I don't think that we always are practicing it like we should be, though, because it's very challenging, and I think it's almost 90% work and 10% life, and it really needs to fluctuate a little bit different, tip that scale differently. So let's talk about how chronic disease has affected our nation, definitely. But how can working through this maybe help with a chronic condition? I know we talked about a couple of specifics earlier, as far as like anxiety, things like that people might have, or pain. But let's talk about like chronic disease, and how does that work, with integrative health and making sure that we can control that disease.
Sure. And so, because it's integrative health, we're not pushing the traditional medical model to the side. We're working within that model. So it's very supportive of whatever health goals that the patient's physician has recommended to them, if that's, for example, a blood pressure goal, weight loss goal. So there are all of those other parts of life that are impacted with a chronic disease, usually sleep, usually stress, usually relationships, often diet, often movement, all of those things, that are just part of our lives really impact the progression of that disease. And sometimes it's an easier entry for the patient or the client to say, I'm really miserable with my sleep and I really want to work on that. It's an easier goal for them than to think about managing their blood pressure. So the byproduct a lot of times is that you address that chronic health condition, but with something that's a little bit easier for the patient to get their arms around, and something that's really dramatically impacting their life. So if it is sleep or if it is a relationship issue, then you can get at that and set some very specific goals, really small ones that are achievable, so they can start to see that, oh yeah, I can do this, and I can use the successes that I already know how to do, the strengths I already know that I have, to chip away at that really big problem. Because if you say, you've got diabetes and you have to fix it, that feels like a lot. But if you say, hey, let's set an alarm for 7 o'clock and get up, or let's go to bed at 9 o'clock instead of midnight and get some sleep, that's something that people can that really do. And so they feel successful, and then they can start to build on those little wins. And so I really like that model just because it supports all the rest of the bigger goal that they're working with.
I love it. I love it. And that's exactly why this is simple steps,
Yeah.
little things that you can do. We know that often you're going to have to take multiple steps, but we want you to take one step at a time so you don't trip. So take
Right.
one little thing, take a nugget that you pulled away from here and incorporate that into something that you can do today. So let's let's go back to mindfulness just a second, because so we went through a little practice, but now I'm sitting by myself and I don't have you talking in my head. Do you have any suggestions? Maybe some ways, maybe you have a favorite or something. I know that there's apps out there. I know there's things on the internet. Anything that you would recommend for somebody to maybe get started when they're trying to come into awareness, but maybe they do need that voice in their head? Do you have any suggestions for that?
Sure, and there are a lot of apps to your point. There are a couple that I like. The one that I particularly like is the Insight Timer, and I don't have any affiliation with any of these apps, but Insight Timer has a lot of different kinds of teachers and a lot of different practices. It's free, and so you can, if you're interested in sleep, there's meditations for sleep. If you're interested in breath, there's meditations for breath. So you can put keywords in there and find the teacher that you like. Headspace is a good one, and Calm is another one. CALM, Calm. I just set a timer on my phone, so that's even easier. You can set a minute, 5 minutes, and just sit and feel your feet and breathe. So part of the reason I love this practice is because it's free. um, if you'd like to work with a teacher, and there is depth to working with the teacher, there are a number of retreat centers and people that teach mindfulness on all kinds of YouTube. You can Google mindfulness teachers. My favorites are Tara Brach, Jack Kornfield. I'll give you a couple more: Sharon Salzberg and Shauna Shapiro. Just because they teach in a tradition that I really like. It's called Insight, and it's really about awareness of your experience. So you start to learn your habitual stories and what you're saying in your head, which is usually mean to yourself. And so just kind of turning down the volume on those stories. So I really like that practice, but there are so many different practices.
Okay. No, that's great. Thank you so much for those suggestions. I think that, that just helps us to have, a little place to go and look. And sometimes, maybe the voice, hearing a voice may or may not resonate with you. So don't think that you're stuck with one person, try different ones. So
yeah, and it's also really important to listen to your own voice. I mean, that's kind of the point too, is just to really have that time, those 3 minutes that you mentioned for yourself, to say, how am I feeling right now? Because we are so hurried, that just opportunity to sit with yourself is a gift.
absolutely. Absolutely. I love that. And so, um, You have told me, and I'm going to let you kind of talk a little bit about it. But Brigette has a great gift for us today. So there'll be a link at the top or the bottom. I'm not sure which way it's going to appear on the video, but it'll be in there. And it'll be Take Charge of Your Health / Brigette. So tell us a little bit about what you're offering for our viewers today.
Thank you for that opportunity too. And so, because we've talked a lot about integrative health and about mindfulness, I'm just offering consultations, so discovery calls to see if you'd like to learn more about what integrative health is and how that might fit for whatever concern or condition that you have. So I have a number of spots open on my schedule for folks that are attending the summit. And so if you come through that link, you can just make an appointment on my schedule. And then on my website as well, there's a link to take a character strength survey that's free, and then also a link to an integrative health assessment tool that's also free. So if they'd like to visit my website, alignedengagement.com, then they'll see the link to those free offers as well.
Perfect. That's wonderful. Thank you so much for that great opportunity. We can go in and learn more about that and have the opportunity to have a session with you. So I want to say thank you, Dr. Brigette, for being here with me today and being a part of the Take Charge of Your Health Summit.
Thanks, Melissa.
Is there anything else you'd like to mention before we go?
I don't think so, other than thank you for the opportunity. I hope the participants benefit from all the speakers and will actually try some of these tips and tricks that we're mentioning and really take charge of their own health. So thank you.
Absolutely. Yes. So thank you again. Thank you for watching Take Charge of Your Health. If you've just tuned in, I hope you've enjoyed this episode, and stay tuned for more great things to come. Have an amazing day, and we'll talk to you next time.